Hello and welcome to Spotlight. I'm your host, Chance Agor. We're coming to you live with part 2 of our two-part discussion about artificial intelligence and its role in the medical industry. Joining me tonight is Dr. Joseph Agor, PhD. Dr. Agor is an assistant professor at Oregon State's School of Mechanical, Industrial, and Manufacturing Engineering. Joe, thanks so much for joining us.
Thank you for having me, Chance.
So, when we get started, can you just briefly describe your understanding and involvement with AI in your line of work?
In my particular area of expertise in relations to AI is in machine learning and learning from data, creating data-driven models and tools to help decision makers in different parts of industry.
Great. And then your field of expertise you've mentioned is healthcare systems engineering. So can you talk about some of the recent developments in that field relating to machine learning and AI?
Sure, absolutely. There has been a lot of push now with this emergence of electronic health records over the past 10, 15 years to develop tools that can help with the assistance of patient care delivery. So those tools can range from the early warning systems that are created for disease and tracking of conditions in hospital, the allocation and disbursement of resources, and also even in the supply chain area, all this types of information and data can be learned so as to make the healthcare hospital or healthcare system more efficient. And there's been entities at the hospital level as well as national federal organizations such as the Center for Medicare Medicaid Services. I'm currently involved in what's called actually an AI Health Outcomes Challenge that was put out by the Center for Medicaid and Medicare Services. So I'm currently involved in developing a prediction algorithm and an AI tool to help them better navigate and coordinate the Medicare population specifically.
So what's involved in the challenge? Do they just lay out an end goal and just tell everyone to just take a crack at it?
Yeah, that's a great question. The AI Health Outcomes Challenge specifically is looking for an AI tool that can utilize the large amounts of data that CMS has to predict when a Medicare patient will have what they call an unplanned visit to a hospital or skilled nursing facility, or an adverse event while they're in the hospital or skilled nursing facility. So that they can better plan. So there are planned visits where you can tell where Medicare or Medicaid patients come, right, and are for a surgery, for a regular checkup, and et cetera. But there are many times that they're seeing in their data that they just randomly come into hospitals and show up. And this is something they need to mitigate against, because then it starts to congest the healthcare system, right, when you have these unplanned visits. And they would like a prediction algorithm that can help them better navigate and allocate resources accordingly.
Okay. Well, thank you for that. We're going to go ahead and play a short video interviewing engineering students about their thoughts on AI. Hi, we're here at Kelly Engineering Center asking engineering students about their thoughts on AI. So first off, would you like to tell me what is your major?
I'm an electrical computer engineering student, third year.
Okay, great. And what are your current thoughts about AI and just what do you know about the field right now?
I am very excited about AI. My knowledge about the field at the moment. Oh gosh, linear regression is a thing. Gradient descent's another thing that's been a breakthrough. Neural networks. There's a lot of buzzwords that I know. Not a lot. I'm hoping to learn more this next spring. Taking CS 331. Introduction to Artificial Intelligence. But yeah, those are what I know about AI at the moment. Yeah.
Okay, great. And how do you think AI can be used in the future to help or impact our lives?
Oh gosh. Okay. It's been since DARPA challenges, and that's another very vague topic that I know a little bit about with in I think early 2010 DARPA challenges with I'm talking about vehicles and self-driving cars, and again, buzzwords that I know very little about, but I know that just self-driving cars in general. Also just being able to pull information. Oh man, there's like, I wish I could gather my thoughts more rather than being like, yeah, come just put on the spot right
No
here.
worries.
But yeah, there's like a whole bunch of different ways I can see AI like benefiting humanity, solving problems in a reasonable amount of time rather than having to give it algorithms that we know work, but that take eons to actually get an actual answer out of them. Yeah. Yeah, solving problems within NP time, within and oh gosh, it's been a minute.
Like shorter time windows than we can currently solve those problems now.
Yeah.
Right. Yeah, I think within 10 to 15 years, we're going to be seeing AI everywhere, like closer to real AI, more advanced than an Alexa or Siri.
Yeah,
And all that.
Yeah. I feel like seeing it everywhere, yes. Getting AI that is, I mean, everybody talks about like, or at least in from what I can tell, everybody talks about like the singularity and like that being right around the corner, getting the AI to produce the next best version of itself. I don't necessarily see that anytime soon, but seeing it in more like more applications based, like seeing it, yeah.
Yeah, I feel like the singularity has been around the corner for the last 10 or 15 years, so it'll be a while.
Yeah.
All right, we're still here at Kelly Engineering Center. What was your name?
Victor Augusto.
Victor, what's your major?
Electrical engineering.
Electrical engineering. And what are your current thoughts about AI, or what knowledge do you have, if any?
Generally positive. You know, we're not approaching Skynet anytime soon, so we're otherwise pretty much fine. I'm excited mostly for the integration of AI further into our technology, into the various processes we use just to make our lives easier. And also in terms of, I guess, professional processes as well. I'm excited to see what gets, you know, I guess as negative as a connotation as the word sound, or the word has, what gets automated next.
No, frankly, I'm excited for automated work because it'll give us more leisure, more time to pursue like creative pursuits. Especially even things as small as scheduling. I've seen there's projects to integrate AI into that to automatically schedule meetings and appointments. Absolutely. And then what specific benefits do you think could come from AI?
You mentioned some of them. You know, it kind of frees us up to pursue other stuff. Additionally, there are optimizations that AI or machine learning algorithms can find or enable that are otherwise unintuitive for people to implement themselves. I'm beginning work this next summer, or this next term, excuse me, with a professor trying to embed machine learning algorithms. Maybe embed's the wrong word, but implement machine learning algorithms towards optimizations in GPU architecture. And that's just it's the kind of complicated work that, you know, while we can find or implement some optimizations ourselves, there's going to be stuff that ends up having benefits where we're just not able to see it right away until algorithmically we can determine that there are benefits.
Right, yeah, there's things that slip through the cracks that, you know, an algorithm would be able to catch that maybe we necessarily couldn't see. All right, well, thank you very much for your time. Absolutely. Have a great day.
Thank you, you too.
And what was your major?
Graphic design.
Graphic design. And yours?
Philosophy, and then graphic design.
Okay. And what do you know about AI at all? Just anything about the field?
I'm not super versed in it, but I find it to be an interesting field and a quickly developing field. I would be interested to see how it can be incorporated into graphic design, but I don't really have too much of a technical understanding of it.
Right. Yeah, I'm sure there's plenty of applications in graphic design and just design in general. Did you have anything to contribute?
I don't know too much about it, but it's interesting to know that it's like a topic that's being brought up in the like university setting for sure. So.
Yeah, I noticed that it's a controversial subject, but I'm not I don't know much on the subject.
Okay. And what benefits do you think it could bring, just that you know of?
I feel like it could probably help us understand more about how we learn ourselves and how we could teach a newly evolving sentient force to learn. I'm actually taking a class called What is Creativity right now, and we discussed this. I'm trying to think of how to describe it. It was this really advanced AI that was able to understand facial recognition, and it basically is growing from like a child state to learn what we are doing and to respond to our facial patterns with its own facial patterns, which was really interesting.
Nice. Do you know when that was, give or take?
It was pretty recent. I think it was in 2014, 2016 maybe.
Okay, so just a couple years ago.
Yeah.
What advances do you think could come from AI in the near future?
Hopefully just like things in our day-to-day lives, or even things that are kind of maybe not so day-to-day, but altogether I think like advances in any sort of thing, technology and just like learning, are all hopefully beneficial things that, especially as like college students, we have to look towards the future of what's going to be happening in the next like 5, 10, 15 years. So being well versed, or at least have a basic understanding of like things like this, is important, whether you're like versed in it or not. So yeah, being aware.
And
Yeah, I think that it'll really benefit the technology side of like living, and I think that with such a technological world we're becoming, I think it will really help in factors such as like medicine and engineering and like design and all of these different kind of careers. It will really help broadcast a lot of careers and help them expand on our knowledge of different areas.
okay, great. Well, thank you all for your time. Welcome back to Spotlight. I'm Chancellor Gear. Joe, any impressions you had about the package, about the interviews with students?
Yeah, I think it was great how much the students actually know about AI and its impacts and kind of where they want to see it going. Specifically, in the video, one of the students, the first student, actually mentioned something about polynomial time solving, and that's something that is in my area of optimization. What we call polynomial time solving is the speed at which these algorithms or machine learning algorithms learn. Right? Some things, if you feed it petabytes of information, although there is a lot of information and these optimization algorithms are sophisticated, it could take maybe years to solve a particular optimization problem or learn a particular set of information. So yes, that's a very active area of research. How do we solve these learning problems in a polynomial time or a quicker fashion, right? So that we can have them run in real time, right, and learn in real time. So that's definitely a challenge, and that's something that's kind of stuck out to me.
Okay, definitely an interesting topic to discuss. We're going to go ahead and go to a quick commercial break. Please stick with us. We'll be right back with Joe Agor.
Across the country, students like me,
are walking together
to bring suicide
and mental health
out of the darkness.
When you're dealing with suicide and depression, it can feel like you're the only person who's going through it.
The Out of the Darkness Campus Walk shows you that you're not alone.
Everybody has these struggles, and it's okay to talk to people. Talking really helps a lot.
This is not a shameful thing. This is something that we can come together and overcome. The Out of the Darkness Walk is a hopeful place. It makes you realize that you're not alone and that your feelings are completely valid.
The experience was so positive, and I have a support network here that I couldn't have gotten anywhere else.
If suicide has touched your life in any way, please join us for an Out of the Darkness Campus Walk.
There's a lot of other people out there who are struggling or who have known somebody who's struggled, and they're here. They've made it out of the darkness, and they're here to help you find your way too.
Walk with us.
Walk with us.
You belong here.
We're all in this fight together.
Register today at afsp.org/campuswalks.
Student Multimedia Studios is your one-stop shop for all of your printing and production needs. If you need a poster for a class or a presentation, we've got you covered with our large format printers. In addition, we check out all of the equipment you could need for your projects and offer production consulting in our studio spaces. Making a video or taking photos for a class? We have studios for photos, videos, and audio. Student Multimedia Services is located on the main floor of the Valley Library, and you can find our hours posted at oregonstate.edu/SMS.
Welcome back to Spotlight. I'm Chance Jagir, still joined by Dr. Joe Agor, and we're discussing AI and its applications in all fields. So, Joe, do you think you could describe one or two examples about how new advances in machine learning technology have impacted the field of artificial intelligence?
Yes, absolutely. There have been some recent work in the modeling of temporal patterns and extracting information from that are modeled in a temporal nature. So when I say temporal, I mean in a time-stamped type of nature. And in relation to healthcare, which again is in my field of interest, the values that are embedded inside of these electronic health records, the value of your heart rate, the value of systolic blood pressure, the value of your physiological nature of your body are important, but also the time between the time and temporal nature of those are also very important. So the fact that your heart rate has been decreasing over the past 30 seconds and your systolic blood pressure has maybe been increasing over the past 30 seconds or past 15 seconds, this time-stamped information and temporal nature of the information is something that these machine learning algorithms have been need to learn from. And there have been some recent developments, specifically a few colleagues of mine at North Carolina State University in the computer science department have been looking at a method called recent temporal pattern mining. So mining these types of patterns that are embedded within the data to help machines specifically learn how to better advise humans and how to better assist humans in making decisions.
Could you elaborate a little bit more on the mining aspect of it? Like what specifically are they looking for from the information?
They're specifically looking for patterns that are information, these types of just patterns, I guess, that you look for. Like you kind of see sequences and combinations of different variables and elements, and also combinations through time, right? That these things are kind of happening sequentially. That's what it's.
Okay, we're going to go ahead and play another video. This is from Samaritan Health Services discussing medical applications of artificial intelligence, as well as a tour of their facility. Let's take a look.
I'm a medical physicist, and what I do is help with I'm on the team in radiation oncology, so I help make sure that the machines deliver the amount of radiation that the doctor prescribes, and I also work with the dosimetrists, the people who make the patient plans, and I oversee the planning process, meaning each individual cancer patient has a plan that's tailored to their disease and their body. So what the doctor prescribes, what the dosimetrist gives us, then the physicist checks it, and then we deliver it on the machine. So a physicist's job is to stand between radiation and the patient and make sure that it's delivered safely. So AI is taking an increased sort of position in radiation oncology. What we do with our patient plans, the patient is scanned, usually with a CT scan, sometimes other imaging like MRI or PET scans, and those sets of images give us a lot of information about the individual patient anatomy as well as the patient's disease. So in the application of AI in radiation oncology, basically large data is gathered. When patients have a CT scan, you get light parts of the image and dark parts of the image, and that really reflects what the patient anatomy is, what the underlying, what we say, electron density is, and we use those for planning. But as you know, most human beings actually have similar organs, right? And they're in similar relation to each other. And so with that being the case, a CT scan of myself and the person next to me would have a similar position of where the kidneys are, where, in my case, the ovaries are, or my stomach. And so on those CT images, those are light and dark parts of the image. So as AI is coming to development, it's looking at large image sets, large data sets of patients. And so it can say, I can take an image of a patient and within a few seconds identify what is a kidney from some adjacent soft tissue structure from down into the bladder. And so it can do what they call auto-segmentation, making the planning process very short. Then you can take actually that plan onto the machine, and there are places that are using what we call onboard imaging, the images that are taken as the patient is being set up and being treated, and they can modify that plan rapidly because we have AI and the capability of what we call auto-segmentation, which I just discussed, which is on the image it can say, this is the soft tissue structure that I think it is based on millions of data points. This is where the kidney would sit in relation to the outside of the body, in relation to the ribs, etc. So AI actually will play an increasing role as computer speeds get quicker, as we can process data much faster. Then AI may become something where the patient's plans are modified on a daily basis. As the patient sets up and their disease in some cases shrinks, the plan will actually modify with the patient as they go through treatment. And so that's sort of the future of AI in radiation oncology from the perspective of planning. There's been a large focus on big data recently, and I think, again, with computers being sort of just advancing at the speed that they are, being able to process that much data, I think AI in most areas of medicine would be beneficial to the end user, which is the patient. My prospect or my thoughts on how feasible it is are really only valid within the context of radiation oncology, and I do think it's very likely that that's going to come to use in many clinics, this sort of using the images from day-to-day treatments to sort of modify the patient treatment and tailor it to the disease as it changes and the patient as their body changes. And so I think it's very feasible. I think it's probably in a near-term setup at this point, because as we can process that much data, we should be utilizing that data as rapidly as we can in order to improve patient outcomes. So this is an accelerator. This is one of the linear accelerators. Here at this facility we have two. This machine will actually rotate around the patient. This couch will go up. The patient in this case would be lying on this device. And we could move the patient into and under the beam. And in this case the beam actually would come out right here out of this part of the machine. And then the machine could rotate around the patient like this. Jesus Christ. So our patients have had a CT scan. We've completed their plan. And so we have two of these types of machines. It's very common for a community cancer center. And so the radiation again would come out. In this case, you'll be able to see as I rotate this around, this is what's called a multi-leaf collimator. They're big, heavy pieces of metal that are blocking off what would be a wide open radiation field if we opened up all that metal. So when we make a patient plan, as the machine rotates, let's say we're trying to treat, for lack of something, just a central structure like the bladder. Imagine if I look at your bladder from straight on, your bladder has a round shape. But if I rotate around to the side, it has a different shape. We make a plan, and this machine will execute and move these little leaves in order to conform to the shape as the machine rotates. So there's a lot of moving pieces, literally, to get the radiation to treat what we want to treat and try to avoid over-treating the normal tissues that are around there. So every day, these imagers will pop out and take an image of the patient, and at the time this patient is being set up to be treated, if those images don't look like they looked on that CT sim image, in an AI world, it would automatically be able to be replanned, and today's treatment would be different than yesterday's treatment, because today the patient imaged slightly different. And so that's how AI would be applied here.
You see this page right here. I'm listing a set of objectives that I want to meet, and the computer is doing the work. It's doing things with control points, bringing it in, helping me reduce the rectal dose, the hip dose, the bladder dose. It's computing right now, or else I would scroll through and show you some stuff. But it's helping maintain the dose distribution I want, minimizing the dose to the critical structures, minimizing toxicity. Because if we overdose a lot of these things, like if you overdose the rectum, they're going to have like rectal stenosis the rest of their life. If we overdose the hips, they're going to have really weak bones in the future too, and it'd be more prone to fractures as they get older. Bladder, it can handle quite a bit of dose, but when we do a lot of stuff like head and necks and stuff like that, if we overdose areas like the spinal cord, they can be paralyzed. You overdose optic chiasm, they can be blind. Brain stem, you could basically die. It's almost like overdosing the spinal cord. They would like not be able to breathe and stuff like that. So our auto planning does so much better job of doing this than we used to do like 10 years ago. Before we had the auto planning, which is a form of AI, we would just do like parallel posed lateral beams, thereby reducing the amount of dose we can give to the patient, reducing cure rate, increasing toxicities. Now we're able to elevate the doses, increase cure rate, decrease toxicities with the AI portion of auto planning within our system. Our most common cancers are prostate, breast, and lung.
What the auto plan does for us is it really helps to create the segments we want. Because in an auto plan patient, we're usually using VMAT, which is volumetric modulated arc therapy. So that's an arc. I think you guys saw the treatment machines where the machine rotated all the way around the patients. So with that arc, it delivers dose every 4 degrees around the patient. So if you do a full arc, you've got 90 different spots where it's delivering dose. And so oftentimes we'll have 2 arcs where we deliver all the way one way and all the way back. So that's 180 different spots where we're delivering dose. And so the auto plan really helps to see what segments we need to deliver dose at each spot as it goes around the patient. So we're able to block out critical structures a little easier, to limit dose to those structures that are near where we're treating that we don't want to get a lot of dose, but also get dose to the tumor or the region where we do need to treat, and get a nice uniform dose to that. It will eliminate hot spots and cold spots, so we get a nice uniform dose to where we're treating, and limit dose to the critical structures near it. Then we also need to take into consideration the length of time that the patient's going to be on the table. If someone's in a lot of pain, we need to take that into consideration to have their treatment be as efficient as possible, because they can't handle a lengthy treatment time. These treatments are actually pretty quick. They can have the patient in and out, Tim, like 10 minutes even for the faster ones. And that includes time of bringing the patient in, doing they call it a cone beam CT on the treatment machine, where they align the patient and get them into the correct position and then go into treatment. So in and out of the room in 10 minutes, sometimes a little bit longer. But this kind of technique has really made the treatment times shorter.
Welcome back to Spotlight. I'm Chance Jagir, still back with Joe Agor. Joe, you mentioned before the show that you actually have been working with Samaritan Health Services. Do you want to just quickly run through what you're doing there and what your goals are from that research?
Absolutely, yeah. We're looking to establish a research connection with Samaritan Health Services, and the specific project that we're trying to work on here is the early identification of sepsis utilizing unstructured electronic health record information, up into including physician notes and note-taking type of dictations that they do. We think that the hypothesis of that research is that this type of information, number one, can be integrated into a structured format, but can also help with the early prediction and early warning for those patients that are susceptible to sepsis, because some of the research indicates that an hour delay in sepsis increases the mortality chances by 8%. So really? Being able to identify it early is an extremely important aspect, and we can utilize machine learning and AI tools and the learning from data to do so. And hopefully, at least our goals are to learn and introduce new learning from unstructured data, such as notes that are taken by physicians, nurses, and other types of medical personnel.
Okay. Well, thank you for that. Unfortunately, that is all the time we have for tonight. So if you enjoyed this show, please be sure to check out more KBVR content, as well as our social media on Instagram, Twitter, and Facebook. Thank you to Joe Agor for coming on the show. Thank you all for watching. Good night.